Welcome to the deep dive. Sometimes the topic just grabs you by the collar, right? Today we're plunging into one that sounds almost like something out of a sci-fi movie gone wrong. Bovine Bonkers syndrome. It sounds intense, it sounds wild, and honestly, it's a lot more common and serious than you might think. This isn't fiction. It's a very real condition affecting cattle, often called ammoniated feed toxicosis. We got a stack of fascinating sources here, veterinary reports, agricultural research, that really shed light on why cattle can literally go bonkers from their feed.
Right. And our mission today is really to cut through that complexity. We want to pull out the most important insights for you. We'll explore the surprising science behind this bizarre phenomenon. We need to understand its distinct forms and uncover some crucial insights for animal health and farming practices. You're going to walk away, I hope, not just informed, but maybe with a deeper appreciation for the incredibly delicate balance needed in livestock nutrition.
Okay, so let's unpack this. Ammoniated feed toxicosis, or bovine bonker syndrome, basically happens when cattle eat feeds or forages treated with anhydrous ammonia or urea.
Standard practice often.
Exactly. These treatments are meant to boost protein content, maybe preserve the feed. But here's the catch, right? Sometimes this process can accidentally create these toxic compounds called imidazoles.
And here's a really crucial distinction, because this bonkers thing actually shows up in two distinct, though related ways. First, you have non-protein nitrogen poisoning, NPN poisoning. That's all about too much ammonia building up in the animal system.
Okay, ammonia overload.
Yes. And then there's the true bovine bonker syndrome that's specifically triggered by a neurotoxin called 4-methylimidazole, 4-MI.
4-MI. Got it. And both of these are, what, acute neurological problems?
Acute, often fatal neurological disorders, yeah. And they typically stem from something going wrong with how the feed is processed or maybe how it's consumed.
A real headache for producers, I imagine.
Yep.
Okay, let's dive into NPN poisoning first. That's the ammonia toxicosis. Now, the NPN sources, it could be urea, synthetic stuff, or natural feedstuffs like what? Rice hulls, beet pulp.
Cottonseed meal, straw, other low-quality forages treated with ammonia, yeah. Animals can even get accidentally exposed to liquid or granular fertilizers sometimes.
Okay, so they ingest this stuff. What happens then inside the cow?
So when they eat these NPN compounds, there's a chemical breakdown hydrolysis that releases a lot of ammonia. This happens mostly because of an enzyme called urease in their rumen, their first stomach compartment.
Right.
Now, normally the microbes in that rumen use this ammonia to build protein. That's the whole point, really.
Yeah.
It's good for the cow, but imagine like a factory getting suddenly flooded with raw materials. If the ammonia production, or just the sheer amount they eat, overwhelms what those microbes can handle.
It backs up.
Exactly. The excess ammonia builds up. It spills out of the rumen, gets absorbed into the bloodstream, and boom, hyperammonemia. The liver, which normally detoxifies ammonia into urea, just gets completely overwhelmed.
Can't keep up.
Can't keep up. So ammonia levels spike in the blood, cerebrospinal fluid, other tissues, and it hits the central nervous system hard. It's essentially ammonia poisoning.
So the rumen, it's this amazing adaptation, but it's also a vulnerability if that balance gets thrown off.
Precisely.
Which explains why some animals might get sick while others on the same farm seem fine. What makes one animal more susceptible?
Well, one of the biggest factors is inadequate acclimation, getting used to it. If you suddenly switch an animal to a diet with NPN sources without gradually introducing it over days or even weeks, you're asking for trouble.
And that adaptation doesn't last long if you stop.
No, it's lost incredibly quickly. Like within 1 to 3 days, if you take NPN out of the diet, you have to start the adaptation process all over again.
Wow, that's a really tight window. What else contributes? Dietary stuff.
Oh, yeah. Dietary imbalances play a huge role. Diets low in energy, high in fiber. They can hinder the microbes' ability to synthesize protein efficiently. That makes the ammonia buildup even worse. And also, consumption patterns matter. Think about hungry animals just wolfing down highly palatable NPN supplements, like liquid molasses or those big protein blocks.
They just gorge on it.
Exactly. They get a massive concentrated dose all at once, increasing their risks significantly.
I can see that. And environmental factors, do they play a part?
They do. Things like an alkaline ruminal pH, a higher pH, actually enhances ammonia absorption. Elevated body temperature in the animal can do the same, increasing both production and absorption. Other factors: decreased water intake, any pre-existing liver disease. Liver's crucial here, remember. And even general stress, things like recent shipping, castration, vaccination. All these can make an animal more vulnerable.
So it sounds like it's rarely just one single thing. It's a mix.
Almost always. It's typically a complex interplay of several factors hitting at once, which, makes prevention challenging but absolutely critical.
Right. So that's the ammonia overload, NPN poisoning. But now let's focus on the one that gives us the name, bovine bonkers. This is caused specifically by that chemical 4-methylimidazole, 4-MI.
Correct.
And this stuff isn't just in the feed naturally, right? It forms during the process.
Exactly. It forms when the ammonia used in the treatment reacts with certain soluble carbohydrates in the feed, specifically reducing sugars. That reaction creates the 4-MI.
Okay, ammonia plus sugars equals neurotoxin. But here's the bit that blew my mind. This 4-MI is also found elsewhere.
Yeah, this is fascinating. It's also a byproduct of the Maillard reaction.
The browning reaction, like in cooking.
That's the one, that non-enzymatic browning that gives bread crusts, roasted coffee, grilled meats their color and flavor. So you actually find 4-MI, albeit usually at lower levels, in some processed human foods, even some caramel colorings.
That's wild. So it's a reminder that, basic chemistry can have really unexpected, nasty consequences in the wrong context.
Absolutely, especially when the balance is off, like in cattle feed ammoniation.
Okay, so unlike NPN poisoning, which you said is often linked to lower quality roughages,
Right.
4-MI toxicosis is specifically linked to ammoniating high-quality feedstuffs, the ones rich in those soluble carbohydrates.
Precisely. Things like high-quality hay, silage, molasses, those protein blocks we mentioned.
That seems so backwards. You'd think treating better quality feed would be safer.
It feels counterintuitive, doesn't
Right.
it? But it's because those high-quality forages paradoxically carry this unique neurological risk because of their higher sugar content.
Mm-hmm.
The low-quality forages, poor in soluble sugars, they're actually comparatively safer for this specific type of nitrogen enrichment.
So it's not about good versus bad feed quality overall, but the specific chemical makeup.
Exactly. It's about the sugar chemistry reacting with the ammonia.
So once this 4-MI forms and the cow eats it, how does it actually, make them go bonkers? What's the mechanism?
Well, at high enough doses, it acts as a powerful convulsant. It directly targets the nervous system, inducing the seizures and those characteristic bonkers neurological signs we see.
It just short circuits things.
Essentially, yes.
Okay, let's talk about those signs. You're a farmer, things seem fine, then suddenly cattle are acting weird. What are those first alarms? Starting with the NPN poisoning the ammonia overload one? You said it's fast.
Incredibly fast. Onset often within 15 minutes to maybe a few hours of eating the problem feed. And sadly, animals are often just found dead. Death can occur within 2 hours of symptoms even starting.
That's terrifyingly quick. What would you see before that?
Early on, you might notice muscle tremors, often subtle, maybe around the face and ears first, signs of abdominal pain, maybe some frothy salivation, frequent urination, teeth grinding.
Okay.
As it gets worse, you'll see incoordination, staggering, definite weakness, labored breathing, what we call dyspnea. They can become agitated, even aggressive. Bloating is common. Sometimes violent struggling, loud bellowing, and then generalized convulsions.
And if they go down, become recumbent.
That's usually a very grave sign. Progression to recumbency is rapid and, often fatal.
Grim. Okay, now for the main event, the bovine bonkers syndrome itself. The 4-MI toxicosis, this is where the name really fits, I guess.
This is absolutely where the name comes from. It's characterized by pronounced hyperexcitability, really wild, aberrant behavior. We're talking restlessness, frantic stampeding, running in circles, literally colliding with fences, feeders, other animals.
Just completely out of control.
Completely. You might also see dilated pupils, maybe some ear twitching, rabbit eye blinking.
But you mentioned something really odd about this one, the intermittent nature.
Yes, and this is crucial for diagnosis. The episodes themselves typically last only about 5 minutes. Then they repeat, maybe every 20 to 30 minutes. But here's the kicker. Between episodes, the affected animals can seem remarkably normal.
Normal, like they just snap out of it.
They can, even start eating again sometimes. This fluctuating presentation is a key diagnostic differentiator. It's quite unique to 4-MI.
Wow. So they have these intense freakouts, then calm down, then freak out again.
That's a pretty good description, yes.
Does that make it harder to spot if you miss an episode?
It certainly can add a layer of complexity. You might examine an animal between episodes and think they're okay. But if you do see an episode, other signs can include sweating, maybe a fever, frequent urination and defecation during the episode, an unsteady gait even between episodes, and generalized muscle tremors. and stimulation loud noises trying to move them can trigger rigidity and full-blown tetanic convulsions.
You mentioned nursing calves earlier. Are they at risk with 4MI?
That's an important consideration, yes, because 4MI can be excreted in the milk, so calves suckling affected dams can show signs. It's not seen in every single case, but the risk is there.
Right. So that raises a big question for farmers. How do you protect the calves if the mother is affected?
It's a major management challenge, definitely.
And generally, are certain ages more susceptible to these conditions overall?
Generally speaking, mature ruminants are the ones most commonly affected by the MPN toxicosis, the ammonia overload. Their susceptibility is influenced by all those factors we discussed: adaptation, feed content, palatability, water intake, stress, liver function.
Right.
For the 4MI toxicosis, though, that potential for nursing calves to be affected through the milk is a really significant factor. It clearly points to toxin transfer.
Okay, so you have an animal showing these alarming signs. How do you figure out what's actually going on? How do you diagnose this?
Well, accurate diagnosis really hinges on strong clinical suspicion combined with a meticulous history. You absolutely need to know what that animal has been eating. For MPN poisoning, you're looking for that rapid onset of signs, plus known exposure to MPN sources, especially if there were recent abrupt diet changes or known issues with feed mixing.
And for the bovine bonkers, what's the dead giveaway in the history or signs?
For bovine bonkers, it's that unique, highly specific hyperexcitability we talked about, the stampeding, circling, colliding with things. Combine that specific behavior with the history of eating ammoniated high-sugar feeds, and you have a very strong presumptive diagnosis. And again, that intermittent nature of the episodes is a really valuable clue for the vet.
Makes sense. Beyond observation and history, what about lab tests? Can they confirm it?
Yes, lab analysis is critical, especially for differentiating the two. For NPN toxicosis, you measure ammonia nitrogen levels in blood, serum, or even vitreous humor from the eye post-mortem. Levels above, say, 2 milligrams per 100 milliliters are indicative. Clinical signs usually pop up around 1 millig/100 millil.
Okay.
Proper sample handling is crucial, though collection and freezing are key for accurate results. Another clue for NPN is the ruminal pH. If it's 7.5 or higher in a recently dead animal, that strongly suggests NPN poisoning because that alkaline environment boosts ammonia absorption.
But for bovine bonkers, the 4MI one, the lab results are different.
Completely different, and this is a vital point. With 4MI toxicosis, blood and rumen ammonia levels are typically normal. Normal. That immediately tells you it's not a simple ammonia overload. It points directly towards 4MI being the culprit. So then you need specific lab analysis of the feed itself to detect and quantify the 4MI content.
That makes the feed testing absolutely crucial then.
Absolutely essential. And what's also important here, maybe a bit frustrating for diagnosis, is the limitation of post-mortem findings. Gross exams and even looking at tissues under the microscope often just show non-specific things like pulmonary edema or general congestion for both conditions.
So the autopsy might not give you the answer.
Often it doesn't provide a definitive diagnosis on its own. It really highlights how critical that careful clinical observation, the detailed feed history, and the specific chemical analysis are.
Okay, so boiling it down for a vet in the field, how do you tell NPN from 4MI? Given the overlap in just general neurological distress, how critical is seeing that specific bonkers behavior?
That specific bonkers behavior is huge. It's the most striking clinical sign for 4MI. Of course, the lab analysis of ammonia levels is the primary scientific differentiator. NPN means high ammonia. 4MI means normal ammonia. But clinically, yes, NPN toxicosis tends towards more general CNS depression, those widespread muscle tremors, incoordination, progressing fast to recumbency, the animal going down. 4MI, on the other hand, is defined by that pronounced intermittent hyperexcitability, the stampeding, circling, colliding. It's visually very, very distinct if you see it.
And you always have to rule out other things too, right? Like infections or other poisonings.
Absolutely. You have to consider other neurological conditions, various encephalomyelitis, other toxic or metabolic brain diseases like grass tetany or polyencephalomalacia, maybe increased intracranial pressure, or even localized brain lesions from trauma or abscesses. It's a complex differential diagnosis list.
Okay, so you've managed to pin down a diagnosis or at least a very strong suspicion. How do you actually manage this crisis? What are the immediate steps?
First things first, absolutely number one. Get all affected animals and potentially exposed animals off the suspected feed source immediately. You have to stop further toxin ingestion. That is paramount.
Stop the poison going in. Makes sense. Then what? for MPN poisoning specifically?
For NPN, the cornerstone of treatment is ruminal acidification. You need to lower the rumen pH. The standard approach is infusing a 5% acetic acid solution, basically, household vinegar, directly into the rumen via a stomach tube, maybe 2 to 8 liters for a typical cow.
Vinegar? Why vinegar?
Because the acetic acid helps convert the readily absorbed free ammonia, NH3, into the less absorbed ammonium ion, NH4+. It traps it in the rumen, reducing absorption into the blood. After the vinegar, you follow up with large volumes of cold water, say 20 to 30 liters.
Cold water.
Yeah, cold water helps dilute the ruminal contents further and also slows down the activity of that urease enzyme, which is producing the ammonia in the first place. In really severe cases, an emergency rumenotomy, surgically opening the rumen to empty it, has even been suggested, though that's obviously a major intervention.
Wow, okay, so that's tackling the ammonia. What about just general supportive care? They're obviously very sick.
Oh, absolutely. Comprehensive supportive care is essential. You need to manage those severe clinical signs. This often includes sedation, maybe with something like asapromazine, to control the excitement or convulsions and prevent the animal from injuring itself. Intravenous fluids are usually critical for dehydration and shock, and providing a quiet, low-stress environment with easy access to food and water. That's also really important for any chance of recovery.
And what is the chance of recovery? What's the prognosis generally?
Honestly, the prognosis is generally poor to grave for animals that are already recumbent down and unable to stand or near death when treatment starts. Even if an animal survives the acute crisis, the recovery can be really prolonged, taking several months. And often, there are significant long-term production losses, like decreased weaning weights for their calves or even infertility issues down the line.
Okay, now shifting to the 4MI toxicosis, the bovine bonkers. You mentioned something pretty stark earlier.
Yeah, and this is a huge challenge. There is currently no specific antidote for 4-methylmidazole toxicosis.
No antidote. So what can you do?
Treatment is primarily limited to supportive care, managing those severe neurological symptoms, the hyperexcitability, the convulsions, and crucially, preventing the animal from inflicting serious self-injury during those bonkers episodes. That might involve heavy sedation, padding stalls, that kind of thing. But again, the most critical intervention by far is immediate removal from the suspected feed source. Stop the 4MI going in.
So much tougher to treat the 4MI directly, which really underscores the need for prevention, doesn't it?
Absolutely. Prevention is key for both forms, but especially critical for 4MI given the lack of specific treatment.
Right. So let's talk prevention and control. How do we safeguard herd health and avoid this mess in the first place? Starting with ammoniation practices.
The single most critical preventive step for bovine bonker syndrome is simply to avoid ammoniating forages that are high in those soluble sugars. So that means not ammoniating high-quality hay, silage, molasses, or protein blocks where that 4MI reaction is likely to occur.
Use it only on the low-sugar stuff.
Exactly. Mature, low-quality roughages, which are naturally low in sugar, pose very little 4MI risk when ammoniated. They're the safer candidates for this type of treatment.
Okay. What about the process itself, controlling the ammonia?
Precise control of the ammonia application rate is crucial. You really shouldn't exceed, say, 3 to 4% of the roughage's dry matter content. Overdoing it increases risk. Managing moisture levels during processing is also vital. You absolutely want to avoid treating wet forages, especially in warm weather, like summer.
Why wet forage specifically?
Because the ammonia tends to concentrate in those wet spots. You can end up with localized pockets of extremely high ammonia concentration and potentially high 4MI formation within the stack. After treatment, ensuring adequate ventilation of the feed before you give it to the animals is essential. Let the excess ammonia gas off.
How long does that take?
Generally, stacks should remain covered for at least 3 weeks to let the reaction complete. Then, they should be uncovered and allowed to air out for maybe 3 to 4 days before feeding.
Okay, so careful selection of forage, careful application, careful airing out. Sounds like process control is key.
It is. And this leads to another point, the human element.
Right, you mentioned the invisible threat, things going wrong in the prep.
Exactly. Issues like improper mixing leading to concentrated MPN pockets, those wet spots we just talked about, inadequate adaptation protocols. These are often down to human error in feed preparation or management. So, effective prevention isn't just about the chemistry. It demands strict protocols, continuous training for the people handling the feed, and regular checks or audits of feeding practices.
Gotcha. And we talked about acclimation for NPN, but it's worth hammering home.
Absolutely essential. Gradual acclimation protocols for any NPN-containing feed introduced over days to weeks are non-negotiable. Abrupt changes are just asking for NPN poisoning. And remember, that's short memory. If NPN is out of the diet for even a day or two, you must reacclimate when you reintroduce it.
Don't skip that step.
Never. Also, avoid those situations where hungry animals get free choice access to really palatable NPN supplements. That just encourages overconsumption. And ensuring the overall ration is balanced, adequate carbohydrates, energy, fiber, helps the rumen microbes use the NPN efficiently, preventing that ammonia buildup.
So good general nutrition helps buffer the risk, too.
Definitely. And rigorous quality control throughout the whole feed processing and storage chain is paramount. Preventing wet spots, ensuring proper mixing, good storage to prevent mold. It all ties together.
What about specific herd management practices? Anything else farmers can do?
Close monitoring is always a primary defense. Watching animal health and behavior closely, especially during any dietary transition, allows for early detection of subtle signs. Prompt intervention makes a huge difference.
Patching it early.
Yes, and a critical point we touched on earlier, feeding ammoniated forages to cows with young calves. Because 4-MI can pass into the milk, it poses a direct risk to nursing calves. It's really advisable to avoid feeding potentially toxic ammoniated feed to cows with very young calves, or at least wait until the calves are older, maybe a month old, have a more developed rumen, and aren't solely reliant on milk.
That's a really practical management tip. Avoid it for the youngest calves.
It's a sensible precaution. Also, minimizing other stressors, shipping, vaccination, castration during periods when NPN is being fed can help, as stress seems to increase susceptibility.
Okay, so it's a multifaceted approach. Careful processing, careful feeding management, careful animal husbandry.
That's the recipe for prevention, yes.
Let's talk about the bottom line. This sounds like it could be incredibly costly for farmers. What's the economic impact?
Oh, it's substantial. Ammoniated feed toxicosis carries a really heavy economic burden for the cattle industry. It hits both direct profitability and, longer-term sustainability.
What are the main direct costs? Dead animals, obviously.
Yes, significant mortality is a huge one. Sudden death is a major capital loss. For individual producers, a severe outbreak can be financially disastrous.
Yeah.
But beyond deaths, you have reduced milk production in dairy cattle. In beef cattle, significantly decreased weight gain studies have reported maybe 20–30% loss in body weight from NPN poisoning. Plus, you have the direct treatment expenses, vet fees, medications, the labor involved in caring for sick animals. It all adds up fast.
And then there are the ripple effects, the indirect costs.
Exactly. Animals that survive often don't just bounce back. They can experience long-term productivity issues. Recovery can take weeks, even months, as we said. You see decreased weaning weights in the calves of affected cows. Reproductive problems are also common, things like abortions, decreased fertility rates.
Wow.
One study noted NPN poisoning was associated with something like a 30% increase in cull rates in affected herds. That means higher replacement costs. These economic consequences, reduced productivity, increased disease, higher culling, often extend far beyond the immediately visible illness. They represent these sort of hidden losses that really undermine a farm's overall profitability and sustainability.
It really highlights how a feed management issue can have such far-reaching financial consequences.
Absolutely. It's not just about sick animals. It's about the economic health of the entire operation.
So, wrapping this up, we've gone pretty deep into ammoniated feed toxicosis today. We have unpacked its dual nature, the NPN ammonia overload, and that truly bizarre 4-MI-induced bovine Bonkers syndrome. We've seen how crucial precise diagnostics are, combining that detailed feed history with specific chemical analysis, especially since the postmortem findings often don't tell the whole story.
That's right. The history and the lab tests on feed or animal fluids are often the key differentiators.
And while treatment options are frustratingly limited, particularly for 4-MI, focusing on immediate source removal and intensive supportive care is the main approach.
Yes, treatment is often a salvage operation, rather than a cure, unfortunately. Which brings us back to the overwhelming message.
Prevention, prevention, prevention.
Exactly. Strict adherence to safe ammoniation protocols, especially avoiding high-sugar forages for 4-MI risk. Meticulous feed management, including gradual acclimation and balanced rations. Rigorous quality control in processing and storage, and vigilant herd monitoring.
It sounds like close collaboration with experts is important too.
Absolutely essential. Working closely with veterinarians and animal nutritionists can help producers develop tailored, safe feeding programs and provide that swift diagnostic support if problems do arise.
This deep dive really reveals how something that seems beneficial on the surface, trying to enhance feed value, can have such profound, unexpected, and frankly bonkers consequences if it's not handled with incredible precision and a deep understanding of the underlying chemistry and biology.
It's a powerful example of unintended consequences in agriculture.
It really makes you wonder, doesn't it, what other seemingly simple practices, maybe in farming, maybe even in our daily lives, might harbor these complex, invisible risks if we don't truly understand the science behind them. What else are we potentially missing, just waiting to go bonkers on us if we're not careful?